Before I enter the patient's room, I'm going to review his chart. At this time, there are no additional precautions, no isolations, and no ordered treatments. So I'm going to enter the room and introduce myself to the patient. Hello, Mr. Irwin. My name is Cassie. I'm going to be your nurse today. How are you?
Fine.
And I'd like to perform a head-to-toe assessment. Is now a good time?
Yes.
Okay. And so I'm going to close the door and pull the curtain for privacy, and I'm going to perform hand hygiene. I'm going to check his hospital bracelet. Can you please tell me your name and date of birth?
Evan Irwin, May 10th, 1988.
Thank you. Do you have any allergies?
No.
Okay, and at this time there are no ordered treatments. I'm going to start off by asking you a few questions. What's today's date?
October 1st.
And today's current president?
Donald Trump.
And are you experiencing any pain on a scale from 0 being the least and no pain at all and 10 being the worst pain?
0.
Okay. And do you have any dietary restrictions?
No.
Would you say you are taking in 3 meals a day, nutritious meals?
Yes.
Okay. And right now I'd like to assess your ability to swallow. Would you please take a drink of this water? Okay, thank you. And are you able to bathe yourself and make it to the restroom by yourself?
Yes.
Okay. At this time, my patient has good skin color and tone for his ethnicity. He's oriented to the time and place. He has good nutritional status, good hygiene, and he communicates well and has good motor and verbal responses. And now I'd like to take your vitals, starting with your temperature, and I'd like to place this pulse oximeter onto your finger. Thank you. Please hold it. Temperature of 98.7 temporal temperature, and his oxygen saturation is reading at 98%. And I'd like to assess your pulse. And his heartbeat is at 60 beats per minute, and his respiratory breaths are at 16 breaths per minute. And now I'd like to take your blood pressure. Just relax this arm, please. (122 over 78), which is normal. And if you would look forward, I'm going to assess your facial symmetry. Okay, normal findings, and I'm going to shine this light into your eye. If you would look forward, please. And your other eye. Thank you. And if you could look at my finger and then look at the wall, and back it to my finger and back to the wall. Thank you. His pupils are equal, round, react to light, and accommodate from near to far. Now I'm going to assess your mucous membranes. I'm starting with your nose. And open your mouth, please. Can you say ah?
Ah.
And his mucous membranes are pink and moist, which are normal findings. And can you please, I'm going to assess your range of motion in your neck. Could you please look from side to side? Touch your ear to your shoulders and look up and back down. Okay, he has good range of motion in his neck. Now I'm going to assess your lungs. If you could please unbutton your shirt. And every time my stethoscope touches your chest, please take a deep breath. Okay, and you're back. Okay, you can put your shirt back on, but please leave it unbuttoned so I can listen to your heart. And while I was assessing his respiratory breaths, which were regular rhythm and normal, I also assessed his skin integrity. His skin was intact, warm, and dry, and free from lesions. And so now I'm going to listen to his heart. Heart rate is regular and has a regular rhythm. Now I'm going to assess your aortic valve. Pulmonary valve. Tricuspid valve. And mitral valve. And I'm just going to pinch your skin right here. Okay. And you can button up your shirt when I'm all done. Skin color is appropriate. He has good skin integrity and good skin turgor. And now I'd like to move on. Oh, leave it up halfway unbuttoned as I assess your abdomen. You can lie down, please. And his abdomen appears flat. I'm going to listen to all 4 quadrants, starting with the right upper quadrant. Left upper quadrant. Left lower quadrant. Right lower quadrant. Okay, vowel sounds are normoactive. And you can sit up. Are you passing gas, Mr. Irwin?
Yep.
Are you having regular bowel movements?
Yes.
And when was your last one?
This morning.
And are you voiding regularly?
Yes.
Okay. Now I'm going to take a look at your fingers. And his nails are clean. Capillary refill less than 3 seconds. And I'm going to check your radial pulse, make sure they're equal. Equal and bilateral pulse. And can you open and close your hands? Okay, can you pull your hands to your body and then extend? And then lift one arm over each head. Okay, and he has good skin integrity, good skin turgor, colors good, and normal hair distribution. And now I'm going to assess your pulse on your feet, called the dorsalis pedis pulses. 2+, which is normal. And now I'm going to assess your tibial pulses. Also 2 pulse and bilateral, and I'm going to assess for edema. No pretibial edema noted. And I'm going to look at your toenails, and they appear to be clean. Capillary refill less than 3 seconds. And can you roll your ankles for me? And And can you press it up against my hands? Okay. And can you lift your knee? And can you extend your feet? Or extend your legs? Thank you. And I also need to assess the resistance on your arms. Can you push up against my hands? Okay, that's good. Skin color is normal. Hair distribution is normal for his gender. Skin is dry and warm. And at this time, I would complete the Morris-Wallis scale, the Braden scale, and document my findings, which are normal and as to be expected with this patient. And all of his findings were within normal range.